Around the world, trauma affects millions of people every year, with many people exposed to several traumatic events during their lifetime. Interpersonal violence, motor vehicle accidents, and disasters like hurricanes, earthquakes, and pandemics can have far-reaching psychological and behavioral effects on individuals and communities. Our talk will be heavily informed by work done at the Center for the Study of Traumatic Stress, which is part of the Department of Psychiatry at the Uniformed Services University, the United States federal training facility for uniformed health professionals. For almost 35 years, the center has studied trauma in the context of disasters, including those affecting military populations, as well as the broader civilian society, learning about and sharing critical information across these communities through research, consultation, education, and training. During our presentation, Individual and Community Trauma, Impact, Risk, and Interventions, Dr. Gary Wynn and I will talk about the psychological and behavioral, as well as neurobiological effects of trauma. We'll consider a broad range of impacts, such as psychological disorders, as well as some of the effects that we don't think about as often, but are things that cause significant public mental health burden and morbidity. I'll talk about issues of who is at risk, what they're at risk for, and when we should be concerned. Just as it's important to understand CPR for use immediately after an acute cardiac event, there are ways we can support the health of our patients and community members after exposure to trauma. So we'll discuss early interventions after exposure to trauma, before disorders occur, to foster well-being and recovery. Dr. Wynn will review current approaches to the treatment of trauma and stress-related disorders, using post-traumatic stress disorder as our prototype trauma and stressor disorder. And he'll include an overview of pharmacotherapy and psychotherapy options, as well as current evidence for complementary and alternative options. I invite you to join us for our session on individual and community trauma, impact, risk, and interventions, and we look forward to seeing you there.